right. Alright, so now for this next task, we're going to look at your vestibulocochlear nerve, which is cranial nerve 8. So now I want you to close your eyes for me. You can leave your glasses on for this task. Alright, so tell me when you hear something.
I hear something.
Alright, which ear is it in?
Left.
Alright, perfect. Tell me if you hear something.
I do. I hear something.
Which ear is it in?
Right.
Alright, perfect. Alright, that's the end of that task. Alright, so this task tests the patient's ability to transmit hearing information from the inner ear to their brain via air conduction. So a normal response would be for the patient to hear the sound in the correct ear, in both ears, and an abnormal response would be for the patient to either hear the sound in neither ear or have a wrong localization of the sound to a different ear or only hear in one ear. So being able to, or not being able to hear a sound in one ear or both could indicate either conductive hearing loss, sensory neural hearing loss, or mixed hearing loss. And the ear that the patient is unable to hear the sound in is the ear that could potentially have that hearing loss. Alright, we will now move on to the bone conduction task, or better known as the Weber task. Alright, so this one involves the fun tuning fork and getting the fun materials out. So, alright, so I'm going to put this tuning fork on the middle of your head, and I want you to tell me if you hear it in the middle, the right, or the left.
The middle.
Alright, perfect. I'm going to do it one more time for you.
The middle.
Alright, perfect. Alright, that is the end of that task. So, for the bone conducting task, that tests the patient's ability to transmit hearing information from the inner ear to the brain via bone conduction. A normal response would be for the patient to hear the frequency in the middle of their head. If the patient hears the frequency on one side or the other, then that would indicate potential hearing loss. For a patient who has conductive hearing loss, then the sound would be heard better in the side of the ear with the conductive hearing loss. If a patient has sensory neural hearing loss, then the sound will be better heard on their good ear that they have. All right. Moving on to the third hearing task, the vestibular task. So this is testing for the vestibulocochlear reflex. Okay, so for this task, I want you to pick an item that you see straight ahead from you and keep your eyes on that item that you see. Alright, so for this task, I'm going to move your head side to sides, and I want you to try and keep your eyes on that item. Alright, I'll get started. I'm going to move your head side to side, so just loosen up your head, and I'll move it, and then move it up and down. Keep moving. Alright, a little bit more. Okay. Alright, perfect. Thank you. Okay, so this task tested the patient's ability to transmit balance information from the inner ear to the brain. A normal response would be for the patient to be able to keep their eyes fixated on the object in front of them, and while their head is in motion. An abnormal response would be for the patient's eyes to deviate or have that nystagmus, or would be for them to get vertigo, which is dizziness, or have thrown off to their equilibrium. If they have nystagmus, if they lose their equilibrium,